Welcome everybody to today's Echo. Today is December 9th, 2022. This is our last Echo of the year. Today we have a full agenda. We have, let me pull it up. We have Gabby doing announcement on a new infectious disease Echo. Anna Garrett is doing 3 presentations all in one. Updates, variant updates, and COVID-19 and pets. And then Christy Duke is talking about vaccination campaign. And I'll go ahead and turn it over to Emily Field, who will do some housekeeping.
You can get continuing education, medical or nursing credits today for joining us. I'm sharing a link. You have to complete the evaluation and also fill out your credentials in the link to get those credits. As Brian said, we are being recorded today. This recording will be available later on our YouTube channel and will also be shared within the week with you. And please feel free throughout the hour to ask questions, either in the chat or following each presentation. And feel free to introduce yourself in the chat as well. And that's all I have.
Okay, great, thank you. We'll move on to Gabby Niski, who will be giving the infectious disease Echo announcement. Gabby, if you want to share your screen.
Yep, give me just one moment. Hello, everyone. 1 second. Okay. We can all see this, correct? Good?
Yes.
Yeah. Okay, just wanted to make sure, technical issues. Okay, hello everyone. My name is Gabby Niski. I'm the infectious disease program manager here at USET, and I want to introduce you to our new infectious disease project Echo that we have going on. So I'll begin on starting on what is it and who should participate in the project Echo. So the project Echo that we have going on right now, as you previously had possibly sat on for this COVID Echo as well, but you may have sat on for the hepatitis C Echoes. We are merging these together into becoming one project Echo, which will be the infectious disease, and we'll focus on a different topic every single month. Some of the topics that we will be including is pneumonia, HIV, women's reproductive health, vaccinations, and other infectious disease pertinent matters within the USET region. The first 3 sessions that we have scheduled tentatively to be on is for strep, mpox, COVID-19 will be the first session. The second session will go into RSV and influenza, and the third month will go into starting the HIV, AIDS, and women's reproductive health. If you're interested in attending, it should be for all of Tribal Nation health directors, clinical staff, physician, nurses, tribal epidemiology staff, and anyone supporting Tribal Nation citizens through the health sector. So then what's the when and why are we doing this? So these Echoes will take place tentatively on the second Friday of every month at the same time that we've had here, 11 a.m. Central, 12 p.m. Eastern, beginning January 20th. And each session will be an hour in length that will provide an opportunity for participants to learn about emerging infectious diseases, gain skills on treating different infectious diseases, continuing to stay up to date on COVID-19, as well as gain continuing education credits as you do so in this COVID Echo. So what is the how? If you are wanting to participate in clinical cases, as we do on the Hep C Echo currently, you are offered to provide any clinical cases. They are encouraged to be submitted to gain insight into healthcare recommendations from other medical providers working in the field, and will be available to submit the cases through an invitation that will be sent out on January 16th. So if you're interested in participating or presenting as well, if you want to be a presenter for one of the presentations that might strike your interest on the topics that we are doing, you're more than welcome to ask to present, and we will welcome your participation on that. And then if you would mind, for those of you who are on the call, We currently have a survey that is getting sent out, and we would like to know if you are interested in participating to give any feedback. And if you would you please just submit your name and email in the chat box, and we will send that to you within the next week or so to get your interest as far as what you would like to see. If you would like to have any specific general areas of infectious disease spoken about, or what your interests were previously on the COVID Echo or Hep C that you liked and would like to continue going forward. If you need any more information, you're more than welcome to reach out to me, Brian Hendricks, or Anna Garrett. And does anybody have any questions?
I don't have any questions, but I have a comment
Yes.
in addition to this. It does say that we are tentatively having these the second Friday of every month. However, January, we're doing it on the 20th, which is the third Friday of the month. So just don't get confused on that.
Thank you.
We did that to give us more time to get resettled in to work. And that's all I have.
Any other questions or comments? Nope. Okay, well, I look forward to seeing you all on the call. If you have any other questions, you're more than welcome to reach out to me. Thank you.
Thank you, Gabby. We'll move on to Anna Garrett to start her presentations.
All right, can everyone see that okay?
Yes.
Okay, perfect. All righty, so our last COVID-19 echo, so sad, but we do have lots of updates today. Maybe. Okay, so first we're going to start with the epidemiology update. So we do have all of our data sources that we've been using for either the monthly or weekly reports that you've been getting. The one I did want to touch on really quick was the HHS Protect data source. Unfortunately, right now, we do not have access to it. So our inpatient hospitalization beds is not up to date, but we are working to regain our access to that. But everything else is up to date with those. So this was the header from last month, and this is the one from this month. So as you can see, we do have an increase in the 7-day positivity rate for the COVID positive test in the IHS Nashville area. And we do have an increase in just the raw number of tests. We're also going to touch on in a little bit some of the variants of concern, but you'll see here we have BQ.1.1, BQ.1, and then we're going to touch on kind of the newest one that's been in the news a lot, XBB. We do see the number of patients hospitalized with COVID-19 in the USET states, and the USET PERCSA has decreased. So for the COVID-19 community levels in the USET states, the low, medium, and high levels have stayed the same. So this was the one from beginning of November, and this is the one from the beginning of December. So you can see here we do have a few counties that have gone into the high level, but still seeing a majority of those in the low and then a few in the medium level. For the wastewater surveillance, this was the one from mid-November, and this is the one from December. So we're seeing essentially all of the states here having reported almost 100% or close to 100% of the wastewater samples that they're sampling as being positive for COVID, which isn't too surprising. For the hospital admissions, this was basically the beginning of November, and then we have the beginning of December. So you can see here the USET PERCSA has just increased a little bit, but remained relatively similar. We have a slight increase in the USET states, and then we do have about a 500 or so person jump in the United States as a whole. So just slightly increasing there, kind of overall in the United States. For inpatient hospital bed utilization, this is the same that was presented last month. Unfortunately, we don't have any new data here, so I'm sorry about that. For the COVID-19 vaccination, so I do have the raw numbers over here on the right, and this is for the IHS Nashville area specifically. So 82,739 doses, so that's amazing. We do have very good vaccination rates in the IHS Nashville area compared to IHS overall at about 55%. And you can see all three of these metrics are just slightly increasing from last month to this month. So we're just going to keep getting people vaccinated and their booster doses. For the percentage of the population fully vaccinated or those who have completed their primary series, again, we have the IHS Nashville area at about 55%, and then we can see all the different other USET states. They're just remaining about the same that they did last month, but some slight increases. And then the percentage of the population fully vaccinated that have received another dose of the COVID-19. So this is the booster dose, the bivalent booster dose that was recently approved. So in the Nashville area, we have a pretty good jump from about 20.4% to 21%. So good job. And then the USET states, we're seeing some slight increases in that as well. The whole percentage of the United States is at about 12.7%. So IHS Nashville area is doing really well in comparison. I do have the data sources linked here in case you're interested in learning more. And that's going to be the end of kind of the general epidemiology updates for COVID in the region. So now we're going to talk about the new variants. So this is the CDC nowcast as of the 3rd, so as of about a week ago. So I know we did talk about this last month on the Echo, but I just did want to reiterate. Last month, we talked a lot about BQ and BQ 1.1. So you can see here again, they're just kind of increasing in proportion in comparison to the other variants. We're seeing BA.5 is slowly kind of falling off there. I do want to bring your attention to XBB, which is this kind of lilac color, light purple. That is increasing pretty steadily here. So we will just want to keep our eye on that one. We're going to talk about BQ.1.1 and XBB in just a second here, more specifically. But throughout the United States, kind of in our region, you can see here it's those same variant proportions reflected. We do have quite a bit higher proportion of XBB up in this Northeast region. So BQ.1.1 and XBB. So XBB is a BA.2 subvariant and BQ.1.1 is a BA.5 subvariant. Essentially, what this means is for both of these, they have additional substitutions, so kind of mutations in that receptor binding domain of the spike protein. So that's the target for vaccines and monoclonal antibodies and a lot of the treatments. So we'll talk about that more in a second, but essentially there's just some mutations in those areas. So that is impacting the efficacy of some of the things that we've been using. So this is a study published on December 7th, just talking about some of these agents and their effectiveness against these subvariants. So they found that bebtelovimab, which was effective previously against BA.1, BA.2, BA.4, and 5, is now having no efficacy against BQ.1.1 or XBB. They also found that all of the different combinations of the monoclonal antibodies, so Evusheld or Regencov-V, didn't neutralize either of these variants. And then they also found, kind of just concluding that bebtelovimab and then the monoclonal antibodies might not be effective against the new variants in a clinical setting. So I did just want to bring your attention here to, I think it's interesting, some of the actual numbers that they found. So you can see up here at the top, we have all the different variants and strains of COVID. So BQ.1.1 is this yellow color, and then XBB is red. So you can see the components of Regencov-V. Nothing really happened here, no effectiveness at all. This black line, that's the kind of original strain of COVID-19, like that first wave. You can see that they're effective against that. And then BA.2 and then BA.5, which are the blue and purple, you can see there is some efficacy against those as well. We have Bebtelovimab, which I was just talking about, the same thing, just kind of reiterating the study results. You can see there's not too much efficacy in that neutralization percentage. And then Evusheld, as you saw before, one of the components over here on the right, and then this component here, which make up Evusheld, are also not effective against the new variants. And then we have the 3 drugs that we have on the market right now for COVID. We have remdesivir, you can see here, it's still having its efficacy, which is good. And then we have molnupiravir, I'm so sorry. We can see that is still effective as well. And then Paxlovid, which is also still effective. So that's good news in all of this. Also, this is showing the activity of the monoclonal antibodies. So you can see Bebtelovimab here. We can see kind of the reduction compared, the green would be the 10-fold reduction, the yellow is the 10 to 100, and then the orange is the 100-fold reduction. So we can see here, it's just not really that effective here. So just kind of further backing up what I was saying. We also have the FDA announcing a few days ago on November 30th, Bebtelovimab is not currently authorized in any region of the US, just kind of based on that information due to the subvariants, it not being effective. This authorization kind of press release did just note that we still do have the 3 medications here that are still approved, so that's good. Another authorization that just came out on the 8th, so yesterday. So the FDA authorized updated or bivalent COVID vaccines for children 6 months of age and older. So there is some stipulations with that. So I'm just going to read it word for word so we don't have any confusion. So those 6 months to 5 years old who have received the monovalent, so the original Moderna COVID-19 vaccine, are now eligible to receive a single booster dose of the updated or bivalent Moderna COVID-19 vaccine 2 months after completing a primary series. So that's very similar to kind of what's been going on with the bivalent vaccine before. Now for Pfizer, those 6 months to 4 years old, this is only for those who have not begun a 3-dose primary series or those who have not yet received their 3rd and final dose of the primary series. They are eligible to receive the new or updated bivalent Pfizer COVID-19 vaccine as the 3rd dose in that primary series. And they would have already had to get the 2 doses of the original monovalent Pfizer vaccine. However, for Pfizer, those who are 6 months to 4 years old, who have already completed the 3-dose primary series with the monovalent Pfizer, they're not eligible for a booster dose of this updated bivalent vaccine yet. So they're thinking that they're likely going to have some new information in January. They're still reviewing data from this. So I did just want to kind of lay out those differences here. And then I have the references if you do want to learn more. Before we jump into our next section, does anyone have any questions on any of that? Okay, seeing none.
I have a question from Keisha.
Yes.
Where did the, okay.
I think you kind of touched on it a little. So just to clarify, if you have infants that are currently in the process of getting their 3 COVID, there are 3 Pfizer doses, do they need to stop at 2 doses now or continue on to get their 3rd dose?
So you said that in this series, they've had their 2 monovalent doses of the Pfizer.
Correct.
Okay, yeah, so then now they would be eligible to get the bivalent as their 3rd dose. So basically, instead of getting the 3 doses of the monovalent vaccine, they're doing it now how you get the 2 doses of the monovalent, and then the 3rd and final of that primary series would now be the bivalent.
Gotcha.
Still reflective of the correct timing and everything, but
Okay.
it's just for those who have already had their 3 doses, they're not yet kind of authorizing an additional 4th dose for the
Okay.
bivalent, if that makes sense.
Yep. Thank you.
Okay, perfect. All right, so now we're going to move on to something a little bit more lighthearted. So COVID-19 and pets. Who here has a pet? Raise your hand or indicate in some way if you have a pet at home. So I'm seeing a lot of you have pets. This is my child right here, Laszlo. You may have heard him in the back of our Zoom. But this is why I wanted to talk about this. It's really important for One Health, veterinary public health, and also healthcare providers to kind of be aware of this information. So first, I'm going to go over a little bit of background information just to kind of set the scene of what I'm talking about. So as most of you know, COVID likely emerged from an animal reservoir. We don't really know the frequency or risk factors of this transmission between species. Obviously, COVID right now that's circulating, the primary factor for transmission is human to human. Animals do have the angiotensin converting enzyme 2 receptor, which is kind of what drives the COVID transmission. So they're able to get it. The risk of an animal spreading COVID-19 to you or to a person is low, which is good. But COVID-19 can spread from people to animals through close contact. And then as of October of this year, we've had 110 pet cats and then 95 pet dogs reported in the US with COVID-19 from their owners. There's also been a lot of reports of zoos having COVID outbreaks in their animals from zookeepers, a lot of big cats, non-human primates. There's been a lot in the news with mink farms and COVID outbreaks, different pet shops, labs, all those have reported transmission. And then it's also to be noted that the animal origin strains may contain additional spike gene mutations, which we kind of talked about before, but those would not be good. And then it's just kind of critical to monitor this transmission just to know what's going on, especially with the threat of kind of new variants, especially with these mutations in the spike gene, which a lot of our treatments are kind of centered around. So just for some more context, the World Organization for Animal Health, they've reported 695 outbreaks in animals globally in the COVID-19 pandemic with 26 species and 36 countries. So I want to just quickly talk about the household transmission of SARS-CoV-2 from humans to pets, since I know a lot of us have pets, just for our own knowledge, and then I'm going to tie this back to healthcare in just a minute. So this study that I'm kind of talking about, they identified human cases, and then they went to the person's home, did a survey, and then they tested their animal, either PCR or antigen testing to confirm COVID in the pet. We don't really need to worry about all the statistics. This is basically just stating that there were dogs and cats who did actually develop clinical signs of COVID, and then those who just were seropositive but didn't have any actual signs. It was noted that more than 50% of pets residing in the household with the owner did actually have awareness of CDC guidelines that were to prevent human to animal transmission of COVID. So they knew kind of what steps they might need to take to not spread it to their pets. There were different percentages of animals in households that the owners did take precaution to prevent transmission to household pets. And then these respondents commonly reported close human to animal contact, and they were actually willing to take measures to prevent transmission to their pets. Kind of two things here at the bottom. it kind of does depend what preventative measures you take, sharing beds and bowls, and then those are kind of the main two. I know when I had COVID, I still had my dog cuddling in bed with me, so that wasn't great, but I mean, I knew what I should be doing. So just kind of understanding that it could possibly transmit to your pet and then what specific steps that you should take. So the current recommendations right now, some of these might seem obvious, but I just want to go over them. Pet owners should get vaccinated. People with COVID should not have contact with pets. You shouldn't allow your pet to have contact with unvaccinated people outside of your household if possible. Obviously, don't put a mask on your pet. Don't obviously wipe your pet with chemical disinfectants or anything that you would disinfect a surface with. If possible, if you do have COVID, try to have someone else in your family care for that pet, just so you can minimize contact. And then just like I said, avoiding contact. So things like petting, sharing food, sleeping in your same bed, letting your pet lick your face. We want to minimize that, especially if you're sick. Wear a mask and wash your hands before and after interacting with pets if possible. Don't surrender, euthanize, or abandon your pet because of COVID. And I know a lot of these things might seem silly to you. I did work in a vet clinic while I was doing my master's, and I'll tell you these recommendations are not silly. We had people calling in all the time wondering about these specific things. So a lot of people generally kind of don't know this. So now I want to just briefly talk about, there was a really amazing session at APHA talking about US vets' perception of discussing COVID vaccination with animal owners during routine visits. So we do obviously have a section of the population that is unvaccinated. So we need to get a little bit creative in trying to reach this population. So a potential solution to that, instead of just, human health advocates, so clinicians, community health workers, we can try to pull in veterinarians to this. So in this survey, there were 103 veterinarians who responded, and this was looking at their willingness and potential barriers to discuss COVID-19 vaccination with owners during a vet visit. So I just have the demographics here. There was a pretty wide age range. Most of the veterinarians were white women. They either practiced in suburban or rural, and then over 90% had been vaccinated for COVID-19. So veterinarians do perceive that they have a public health role in providing reliable and accurate COVID-19 information, especially information related to approved vaccines. Vets are aware of a lot of different barriers that can come from these discussions within a vet visit, such as scope of practice. Obviously, they're not a clinician, so they can't give medical advice to a person. Discussing vaccines might shift away from the main purpose of the visit, which is the animal's health. And then obviously there's been a lot of politicization around vaccines, and they wouldn't want that to impact any client-vet relationship. But about 90% of vets either completely or somewhat agreed that veterinarians are human health advocates. We do need some additional kind of guidance from state or national or maybe even tribal authorities on licensing, liability, and policy when it comes to using vets for this human health information. So why should you care? So according to the American Veterinary Medical Association, about 40% of households own a dog, and these people visit the vet about 2.4 times a year. And a little over 25% of households own a cat, and they visit the vet about 1.3 times per year. And this was back in 2017 and 2018. So I know a lot of us got pets over the pandemic. So some new numbers from the American Pet Products Association, about 69 million households own a dog, and over 45 million households own a cat. 90.5 million families own any pet at all. So getting this information out to people during a veterinary visit, we might be able to cover some different kind of parts of the population who may not come in for their own health. And then I do have the current pet ownership by generation. So you can see it's widely dispersed over the generations. I have just some quotes here from vets. So veterinarians have been on the front lines educating pet owners and members of the public, in addition to serving in local, state, and federal public health departments to combat the pandemic. We have a quote that says, most of us in veterinary medicine work directly with communities, and we understand no one likes to be told what to do or that we're better than the client. Listening and valuing where others are coming from is necessary to work toward a common goal. And then the very real threat from these zoonotic diseases is practically shouting at us that a One Health approach is essential. So just some personal reflections for myself, since I did work in a veterinary clinic through a large majority of the pandemic and before. We had clients calling in all the time, wondering if the vaccine was safe, if they should get it, asking us human health questions on the phone and in the room or over telemedicine. They're asking the vets their opinion, and we didn't really have any official, guidance specifically for veterinarians. So we just kind of did the best we could with the information we had. So a potential solution would be, if you work at a healthcare facility or a clinic, maybe reaching out to your local vets and providing them some fact sheets or handouts or brochures that they could distribute, or just telling them, where a person could get a vaccine. That would be helpful to give them a referral. So just understanding that a lot of these things are connected, and a lot of people are going to the vet and using these veterinary services. So we could potentially kind of have a creative approach to reaching these populations who aren't vaccinated. During my time, we had a lot of people having sudden emergency, ivermectin needs from clients we'd never seen before. When ivermectin, was in the news that it potentially could cure COVID, which it doesn't. But veterinarians are kind of seeing these shifts in the public information and all of this. So I just want to bring up, potentially we could use a One Health approach here to engage this sector of medicine. Even though it is focused on animals, animals have to come to the vet with a person, fortunately or unfortunately. I have the references here, and then I'd love to hear any of your thoughts on that, since it is kind of something we've never talked about before. Or any comments in general. But if not, that is gonna wrap up my portion.
I thought that was very interesting, Anna. Thank you, about pets. I actually sent Brian a photo, which he's going to share with everybody. We are wanting to know if this is an effective public health strategy for preventing COVID transmission between humans and animals. Brian's going to pull it up. It didn't last very long, so the longevity of it is questionable. Are you able to get it up? There it is. There we go. Can you make it bigger? That's my 12-year-old right at the beginning of the pandemic, and her method of trying to prevent my dog, our very bad dog, from getting COVID. And she just stuck a sock on his muzzle. So I would think that that's probably not very effective. So go ahead, Brian, you can go to the presentation. It didn't last long. He wasn't tolerating it at all. So I just thought I'd share that with y'all. So I think the takeaway of all of these presentations, as we know, and as Anna mentioned, is that vaccination became very, very political, very divisive, sorry. And there just was a whole lot of tension around it. During that time, the USET tribal epicenter early on, we really wanted to try to target tribal citizens to get the vaccine. And we weren't entirely sure the best way to go about that. So you can go ahead and go to the next slide, Brian. So we decided to contract with an organization called the Rescue Agency, and they are a public health agency with experience with social marketing and the behavioral change model and getting people to change their behavior in order to have a specific health outcome. So we went ahead and contracted with them for assistance on this project. And at the end of this, I'm going to share some resources for you guys that we shared earlier on, but they're still available for your use. And I think with the information that Anna presented about the increase in cases, not currently the increase in hospitalization so much, but my guess is that may be coming. We often see that that's a delay, so we'll keep watching for that. But we're going to need to start doubling down on vaccination, getting people boosted, all those sorts of things. So these resources are still available to you guys if you're interested. So just a little bit of background. They started with one phase and they developed some just general materials that we still have that I'll show you kind of at the end of the very end of the presentation. But they started with a general lit review. They looked in all the different literature sources, and early on there wasn't just a whole lot, but the Urban Indian Health Institute had surveyed some tribal citizens. And that was very helpful, but they just did the general lit review. And one of the things that we learned is that the no group probably were not going to change their mind. It was a hard no, nothing was going to change their mind. And so we decided there's still, even though we didn't hear about them so much because of the divisiveness, we decided to, there still was a very large group of what we call wait and seers. I'm not exactly against vaccination, but I'm not entirely sure either, or the vaccine hesitant. So we heard a lot about those. So based on that phase one lit review, that's what we really decided to target. So we went into phase two, or the rescue agency did. And what they did is they conducted focus groups amongst specifically USET tribal citizens 18 and older. We screened 655 and we were actually shocked. We sent out an email and asked everyone to share. We shared on social media basically saying, hey, we're doing these focus groups. Would you like to participate? Here's a screener to see if you qualify. There were some non-tribal folks that responded, probably some employees or community members. So just going through and making sure that they met the criteria. And there were 59 that qualified and 27 interviewed. For their time, they received a small gift card, I believe it was $50 or something like that, to participate in an online, well, several online focus groups. So based on the results of those wait and seer groups, the main takeaway that we got from them is that they felt like there was a lack of research on long-term safety or effectiveness. So we really wanted to hone in on that message to them. But as well, a takeaway was, you know, it just hasn't been tested enough. They also felt, surprisingly, they realized that COVID was a threat, but that they also realized that the threat may not have been to them. There was a higher risk groups. And so that's why they weren't taking it, because they felt like that they were lower risk and they really didn't need to. But it wasn't so much of, we don't think COVID is a problem at all. They fully realized that it was a problem. They also kind of felt a balance between personal choice, but also responsibility for the community. And they also said that they felt like that their tribal nation leadership was a trusted source of information. So utilizing those four themes, the rescue agency tested some messaging and graphics with the focus group participants, and based on their feedback, they developed 4 different campaign areas. And within those campaigns, they developed materials, which we have highlighted on our website, flyers, signs, social media posts. And I do want to point out, Brian, you can go ahead and pull up the website. I do want to point out that these graphics can be customized to your tribal nation. Either the USET communications team can customize them for you, or if you have your own comms department, we can send you, I believe they're InDesign files. We can send those files and your comms department can customize this as they see fit. So here's our website that has the entire toolkit on it, and you can pick and choose whatever you want. And Brian has put that in the link. And the campaign area number 1 highlights. Can you go down so I can read that message, Brian? No. Sorry, scroll back up a little bit. Message. Okay, under campaign area 1, it says message. So this was the overarching theme of this campaign area. COVID-19 is an imminent threat to our health and communities. Do your part to protect yourself and stop the spread of the virus by using the most effective prevention tool available, the vaccine. So we're playing into their sense of responsibility to their own health, but also to the health of their community. And you can see we developed a poster. Brian, if you can just kind of maximize that for just a second so they can read the text. So it just has some general information. Basically, being strong, healthy, and young isn't enough to protect against COVID-19. So targeting those people that felt like that they were in the lower risk category, along with some statistics and different just facts they could use and different information. And you can go ahead and go back. So that was kind of the first campaign. But in addition to that, there's a social media graphic that you have within, if your comms department, they can take that thumbnail, and then we have the post copy. You can just copy and paste it for both Instagram and Facebook with the messaging that goes along with that graphic. Also Facebook, Instagram stories, which is a little bit of a different mechanism on social media. You know, just it's a bigger threat to tribal nations, build resistance to the vaccine. You can, if you've got your own Facebook or Instagram page, or your tribal nation has its own, you can utilize that. You can utilize the Facebook profile header as well for your Facebook page or your tribal Facebook page. And then there's stickers, so little Instagram stickers that can be used. But also we created some physical media as well. One of our tribal nations actually asked for yard signs. And so we went ahead and had those made. And that was a really effective tool to kind of just advertise. People wanted to be able to put in their own front yard about vaccination campaigns. And I guess I forgot to mention kind of a big point, the name of the campaign that we did tested, it was market tested amongst the folks that participated in the focus groups, was Vax-A-Nation. And this occurred, I guess it was probably about a year after, maybe 9 months after the vaccine first came out. And surprisingly, I was really surprised nobody else had come up with this and taken it, but we got to get it, and that's our slogan. So I was really happy to get that. So campaign area 2 for the vaccination campaign. Vaccines are safe and effective and far less dangerous than getting COVID-19 itself. Nearly 200 million people in the US have received COVID-19 vaccines under the most intense safety monitoring in US history. So really trying to combat the misinformation that was out there. And I will say we are in the process of updating these statistics. Obviously, it's a lot more than that now that have received the vaccine. So hopefully by the end of next week, we will have those updated for you guys. If you could just click on that first poster, Brian. And I'm not going to read it all, but just looking at safety, efficacy, and side effects, acknowledging, yes, there are some potential side effects out there, and also acknowledging that there has been controversy in it and addressing that ahead of time. And that's a poster that can be printed out and used either in your clinic or around your community. And again, these can be customized with your tribal seal. You can go ahead and go back, Brian. And here's a flyer, and it basically says similar things to up above. If you want to do like a foldable flyer, or just a single fact sheet, the 8.5 by 11 size, you could utilize that. So in this talks specifically too about targeting tribal nations, and that the data that tribal nations have seen in implementing vaccine strategies, and that they are seeing lower rates of COVID and complications. And then again, just some digital banners. And I really like that it's not too late one, especially now. That might be a good one to utilize for digital banners. Yeah, just go ahead and scroll through that. And those are all the different social media graphics that we have. They can be utilized, they could be rotated, you know, on a weekly basis, or, you know, twice a week, or whatever works for you and whatever you like best. Okay, campaign area 3. I believe this is the first one that we see where we see actual people involved, and not just produced graphics. We really worked hard at utilizing images. We were not able to get photographs from our tribal nations. Unfortunately, it just, everybody was so busy in trying to combat COVID and getting those releases and getting professional photo. We just didn't have time. But we tried really hard to look for, these are stock images that did not have plains themes in them, and more of a Western look. We really wanted to try it to look Eastern as much as we possibly could. So we really worked at making sure those images weren't in there. Brian, can you, I want to read that message just real quick. Yeah, okay. So this campaign area focuses on personal responsibility. The decision to get vaccinated is personal, and it comes with peace of mind that you're helping others to stay safe. So it's acknowledging that there is a choice, but by making that choice, you are protecting your community. And then before making your decision, get the facts from a source you trust, your tribal nation. So really working and listening to the tribal nation, because again, we did the research stating that that was a trusted source of information. And I believe this was a poster, right, Brian? I think it was a poster or a flyer. And it just gives little snippets, and you can see the insert tribal logo here. If you need assistance with that, you can again reach out to our comms and they can plop your tribal logo in, or you can send it to, if you have your own comms department. And then if you have hashtags around vaccination, you can utilize those. We could point it to the CDC site. We can point it to different sites, but we can hashtag those, and that's TBD hashtag, and we can help you develop those. Okay. And just a flyer with the same information there. And you can go ahead and go down, and more social media graphics that say the same thing, and you can stop right there. The Instagram stories. So this one here, it's got 4 different graphics to it. So it's telling a story as you utilize those graphics. So again, both for Facebook and Instagram. And we've got several of those stories, a male and a female, some family imagery. All right, in the last campaign area, highlights, we really want to target some of the myths around COVID-19, get the real facts about how vaccines work, turn to your tribal nation for the most trusted and accurate information. And we've got a poster, and it just really combats some of the myths that were out there. So you could utilize that. That would be a good poster for your clinic. Or you know, just within the community. And again, we have this, it's 6 months without incident, so we are updating those statistics so we can get you the most accurate information possible. And then acknowledging that there is confusion around the vaccines, and you don't have to maximize that, Brian, it's okay. And those are just fact sheets that can be handed out. another social media graphic that can be used, and also acknowledging too that there's a lot of scary things that we're hearing. And again, Instagram stories that can be used, and you can just kind of scroll slowly past those. I'm not going to read them all to everybody. Okay. So those are the 4 main campaign areas that we do have. And if you go all the way to the bottom, there was some additional materials, just some social media graphics about just general vaccine promotion. So doesn't necessarily have to be COVID-19 related, but just general vaccine. And it has the copy there too that you could utilize. Any of that can be tailored as well. So I just really wanted to highlight that because we did have that done. And I do still think that those are good resources, especially now that we're going to be pushing booster shots. But I'm hoping if you want to reach out to us, as always, USET EPI at usetinc.org. That's kind of our main email address. And I've got it there. And then I also have a link to the vaccination campaign, which Brian also put into the chat. Are there any questions from anyone? No? Okay, well, I know Gabby is especially looking forward to see your feedback on transitioning them from COVID to general infectious disease. So be looking for that survey. And again, if you would like any of these resources at all, please reach out to us. Do not put a sock on your dog's nose for COVID protection. It won't work. So that's all I got, y'all. Does anybody else have any questions before we wrap up?
Thank you all for some really wonderful presentations. I learned a lot, as always. Just as to reiterate Gabby's presentation, this is the last COVID-19 echo. We will be transitioning to the infectious disease echo. It will start on January 20th at same time, 11 o'clock. We will send out information for that next week. You will need to register for this series. So the registration link will be in the email that we send out. Anna?
I did just want to reiterate on the infectious disease echo, we're going to be doing the COVID EPI updates like we do at the beginning. So we'll still have that. And then we'll also be adding in influenza EPI updates. If you are a health director or on tribal council or anything, we are going to be starting to send out influenza reports soon here, kind of in the same way we have been doing the COVID reports. So you'll still be getting the EPI updates for COVID and flu on the infectious disease echo as well.
And I just wanted to add, I saw some new people that popped on. Again, if you are interested in receiving the interest survey in regards to the infectious disease echo, if you don't mind just adding your name and your email address, I'll send it over to you. Thank you.
And so the first session is going to be on COVID-19. So it's not really the last COVID-19 echo. COVID-19, mpox, and strep. So we will be having Anna Garrett present again, and Dr. Brown will present on strep A. So if there's no further questions, thank you, Erica. If there's no further questions or comments, we will wrap up. We will send the survey out to the health directors too, to send out to their clinicians.
I saw that you unmuted. Did you have a question or anything?
No, I'm good. I apologize.
No, that's okay. I just wanted to make sure we didn't skip over you.
I did want to thank you folks. I think it's been very meaningful. I had to get in late, but I got some good information and I will reach out for some of those posters.
Okay, great. Thank you.
Great. Thank you all. Have a great rest of your day and have a happy holiday. Thank you all.
Thanks.
Bye.